A very good day, my dear students. I welcome you to a new entity called charts in pathology. I shall be concentrating on hematology. These charts are meant to be practical exercises. They will be carrying a full 5 marks or even more. You are supposed to diagnose, describe, as well as answer the questions. Clinical history will be given, but we should not be going too much towards that. Let us see how we can handle it. There are certain general guidelines which we shall and will follow. Do not look for clues in the history of the case. See the images of the slides and the charts. You must describe. A definite theory knowledge is mandatory. There will be a lot of overlap between these. Questions may or may not be asked by the examiners. Do not by heart the points in the chart. Slide may be kept for a description. Draw a diagram if possible. With this in mind, see the pictures and they may vary. The picture that I show and what is on the chart may be different. And please do remember, all charts are university questions in theory itself. The first chart I'm taking up is Eosinophils. See, there is a cell that I had shown you. This can be drawn schematically. It is a bilobe or a spectacle-shaped nucleus, and I'm finding multiple large coarse granules in the cytoplasm, which are brick red in color. The percentage is given over here, 1 to 6%. Then there is something called as absolute eosinophil count, which is 40 to 400 cells per cubic millimeter. Nucleus is usually 2 lobes, but it can be 3 lobes. This is a nice diagram for us to draw. And this is what we roughly see in the smear. The rest of it, I will not be going into. It has got its own precursors. Kindly read up. This can be a chart that is kept for us. In this, I am finding the RBCs. They are almost normal. They may be microcytic hypochromic. But what is important is the cells here. Do not diagnose them by means of the bilobes or spectacles. You are supposed to identify them by the eosinophilic granules. That is the brick red granules. They are large cells, nearly twice the size of the RBC. And there may be trilobed one in pediatrics particularly. Nucleus is not obscured by the granules. This is one of the points. Look at this. Again, I'm finding numerous brick red granules and bilobe nucleus. And this is a neutrophil. Neutrophil is smaller than the eosinophil, and these are the RBCs and platelets in the back. Causes of eosinophilia, students are very miserable in their answers. The normal count, absolute count can be 40 to 440. But when it is more than 500, we call it as eosinophilia. I've given you an entire list of it. I would like you people to kindly memorize at least half a dozen. You should rattle off. There are some malignancies where you can get, such as a Hodgkin's lymphoma, eosinophilic leukemia. A lot of other conditions are given, Loeffler's pneumonia, which will happen in a case of R.A.T.S, worm infestations, dermatitis, allergic disorders such as hay fever, rhinitis, or bronchial asthma. Please do memorize it. The diagnosis is eosinophilia.